I'm Curt Kubiak. I'm the Chief Executive Officer at the Orthopedic and Sports Institute, or OSI, and we supply musculoskeletal care in a comprehensive fashion on one campus, so start to finish, all in one location. So the Orthopedic and Sports Institute, from the time that the physicians that started this facility conceived of it, was going to be a different way to deliver orthopedic service. And it was all around the patient. So it's convenience for the patient. It's a retail experience as opposed to a clinical experience. So even as you feel coming into the building, the anxiety, hopefully that level is taken down a notch. Patients feel more like guests here than they do a patient. And we're trying to do the best to take care of them with regard to the way that they feel while they're with us, but also a more cost-effective solution, and also with higher quality, because we concentrate on a single specialty, so we can get the fine-tuned components maybe a little bit tighter and provide a little bit better quality service for our patients. And so some of the things that we're doing differently are making it easier for patients financially. So we've got a low-cost solution, as I've made mention of, but we're also price bundling. So we can tell you for 60 different procedures that we perform here on our campus what the cost is before you go in. So from a patient's perspective, they really like that idea of being able to know what they're responsible for, what the total cost is going to be, even prior to going in. And then post-operatively, you get one bill in the mail. So that's a unique thing for us in the commercial space. Other groups are pursuing it, but I think we've probably got more included than other groups may have at this point in time. We've also got the ability to do a total joint replacements, hips and knees, in our outpatient setting. So we were the first in the country to have a skilled nursing facility attached to our surgery center. So that gave us the capability of a facility that would typically take care of somebody inpatient, but we could do it in our center. So our recovery in allows us that capability. So we've done, I think it's over 1,500 total joints since we started this in 2010. So we're really proud of the fact that we can bring more complex cases here. And then most recently, we've got a relationship with 6 neurosurgeons. And so now we're doing complex spine cases here in our outpatient setting. And it speaks to the way that we also work with partners, right? So we don't own that recovery in space. We have a partner, eDuro, that runs that space for us. And similarly, the neurosurgeons aren't members of OSI proper, but they're visiting here from the neuroscience group and the neurospine group. And they allow our patient population that needs that kind of care the ability to have those types of procedures done as well. So it's neat to be able to partner with some of our medical colleagues to bring some of these innovations to life. Our group started here in Appleton with our main campus here, where we've got great partnerships with Advanced Physical Therapy, eDuro, and our physician groups that are here, as well as Great Lakes Orthotics on this campus. And then expanding, we've got clinic space with both exam rooms as well as some physical therapy space in Ripon, Wapaka, New London, Shawano, and we're going to be expanding that concept probably up and down the 41 corridor, because it's a lot easier for patients to access us that way. So we'll be looking to the north, probably to that Green Bay area, and then looking to the south, to that Neenah, Oshkosh, Fond du Lac area. This is where our patients are telling us they'd like us to have locations, so that we're a little bit more accessible.